you so much, everybody, for joining us today. We'll just get started as we wait for more participants to join us. So, my name is Hezron, and I'll be your moderator for today. And I'd just like to share a few ground rules before we get started to ensure that the session runs smoothly. So the first one is, please ensure your microphones are muted during the session to avoid interruptions. And also, please note down your concerns and questions during the session so that they'll be responded to at the end of the session. So I'd like to welcome my colleague, Dr. David, who will be taking us through the topic for today, which is patient responsibility in healthcare. Welcome, David.
Thank you so much, Hezron. And thank you everyone for having joined in for this session. We are glad that you are here with us on time. Actually, by 4 p.m. you're already in, and that's an achievement for us. So as we're going to get into the session today, our topic is patient responsibility in healthcare. And this is a very important topic because over time we've had people talking about patient rights, quality healthcare, ensuring access to healthcare for everyone. Even now when we're all talking about universal healthcare coverage, that is UHC, people are talking about it in terms of how can people get access to the quality care that they need, which is key. But at the end of the day, every stakeholder, we need engagement of every other person who is involved in ensuring there's access to healthcare to be part of the game, part of the equation that's going to solve our challenges that we're having with healthcare. And on all the discussions that we've had people talking about government responsibility, social accountability for health, where most of it's been a matter of having the patients and the public call on governments and leaders to do the right thing. And that right thing, according to our societal perception, is telling the government to invest in healthcare, to improve on the financing. That is according to the Abuja declaration that wants it to be at 15% of the government expenditure, which is ideal. The government to invest in human resources for health, the health workforce. That is also another important factor that is being factored when we talk about social accountability, access to health preventive, promotion, curative, rehabilitative, and palliative services. So those are all issues that need to be catered for when we're looking at ensuring access to quality healthcare services for all when and where they need them without having to suffer any financial hardship, or paying for that healthcare should not get them to be in poverty as a result of that expense, which might be so high. So when we look at all those factors, it's always in light of ensuring the patient has the best outcomes in their care. But now what we need to ask is, in all that arrangement, what does the patient's responsibility come into? How does it get to a point that we are going to ensure that the patients receive the optimal care that they need within the right arrangements? And in that right arrangement in terms of service access, this patient is able to play an active role in that care to ensure that it's meeting their actual needs. Because even now when we talk about different other matters in the society, we've had an issue where we are talking about policies are not responsive to our need, because we feel like there are people who formulate policies without even having to contextualize them to our needs as a society. So those are some of the things that are there. But now for us in the healthcare space, the target audience is to ensure everyone is healthy. And when we get to care, we consider everybody who needs and should get access to quality healthcare services to be a patient. So the background is a patient is anyone in need of healthcare services at any one point in order to be at their optimum in terms of functioning in a society, while at the same time being free of disease. So when you're healthy, we talk about health is not only the absence of disease. To be healthy, it's not only the absence of disease, it's not only the absence of a disability or infirmity, but it's the ability to live optimally and achieve your optimal function as a human being, contribute to your society, and to be at the best state socially, that is with the people you interact with. Culturally, we have cultures where we exist, also related to the social component. Financially, you are okay, and psychologically, you're also at the best state of mind. So when all the different domains of our human existence are at optimum, then we consider ourselves healthy. If we are not in that state, then we are unhealthy, and in that case, we are a patient and we need healthcare services. And as I mentioned at the start, We have healthcare services, which range from the health promotion, disease prevention, curative services, rehabilitative, and palliative services. So that's the whole range of the healthcare services that we're talking about when we talk about access to healthcare services. So which services do we need? And anybody who needs any of these 5 categories that I've mentioned is a patient. So when, for example, personally as David, where I am, I need health promotive services because I need to stay healthy. I need to get information on how I can live an active life. I need the information and the guidance in case, for example, the vital checkups. That is a healthcare service. So if I can get those measurements taken for me and it guides me in how to lead my life, then I have the responsibility to ensure I seek that information under a number of other factors. Disease prevention, we have, for example, if I'm traveling from Nairobi to my home community in Siaya County, then knowing that that is a region that is malaria prone, then I have to get the preventive measures, prophylactic management, maybe a dose of mefloquine. That means disease prevention. When I get to that place where I'm going to sleep, I have to ensure that I have mosquito net. In the neighborhood, if there are shrubs and all that which are harboring sites for mosquitoes, they need to be sprayed, fumigation and all. Those are disease prevention measures. I need those services because at that case, if I don't take the necessary measures, I'll be prone to getting sick, so I'm not preventing disease. And those are some of the healthcare services as well that we need. Then when I get sick, now we hear of almost every other day, we get a number of people who are being diagnosed with COVID-19. When they are sick, if there was a cure, they need to be treated and get cured. If they can't be cured, they need palliative services, supportive care. And that is also something that is being given. And then rehabilitative services where you are not in the best state. For example, we talk about it in drug abuse and drug use and drug abuse. And then other than rehabilitative and drug use, we need people who have mental health issues and mental health diseases, and they need to get the psychotherapy support, rehabilitative care. That's another important thing. When you have a broken bone because of a fracture and all that, rehabilitation is to enable that body part that is affected to get back to its normal functioning state. So all these are services that we need. And when we need them, we have to acknowledge that as individuals, as members of the society, we have a responsibility and we have a role to play. So in order to access them, the best form which translates to quality and optimal outcomes, the main outcome is to either stay healthy and to be optimally functioning in a society. When we are sick, we need to be cured. The disease has to be eradicated. That is another important thing. Then if I'm having a difficulty, I need to get back to normal function, rehabilitated. When I can't be cured, I can't be rehabilitated to optimal function, then I need supportive care to improve the quality of life that I'm going to live as an individual. So that palliative care, for example, you have cancer patients being given morphine and other pain management medicines to reduce the pain that they are going through so that they have a better quality of life before the ultimate outcome, which is we're all going to die. So before they die, they live a better life free of suffering. Or if there's suffering, the suffering should be at the minimal level possible. So in that case, we look at all these. So far, we have issues that people have been talking about, patient rights. And in a way, it's a good thing to talk about the right because these are freedoms and privileges that we are entitled to, and we need to get them as patients. But at the same time, it had led to some form of entitlement that as individuals in the society, we are not doing what we feel is right for us. But at the same time, we are the very people who will keep blaming others for not doing what they need to do. It starts from me as a person being accountable for my well-being, being responsible for my health, and beyond that, ensuring that every other person, my right ends when it infringes on another person's freedom. Even when we talk about freedom of speech, we all have the freedom of speech. But at the end of the day, if I use my freedom of speech to insult another person, to incite a group of people against another group of persons, then that is an infringement on their right. So our patient rights as individuals have made some of us get entitled. And with that entitlement, we are affecting the access to the quality of care that we need. We expect the ability of other people who are mandated to ensure we have access to these quality services to deliver on their mandate. Because when you're entitled, you are provocative, you are aggressive, and you affect the other person's ability to function optimally. So that is one thing that we also have to factor. And this is something that has been in the debates, physician responsibility, and that's why we have litigations where negligence is an issue that's coming up every other day. Other than negligence, we have issues of people blaming doctors for misconduct, medical misconduct, professional misconduct, and all that. These are things that have been in the place. They need to be pushed for so that we have less of such errors, such mistakes. But at the same time, we need to factor the patient responsibility in ensuring these errors don't get to happen. And even in terms of government responsibility, financing, policies have to be in place, promoting local production of, let's say, medical products and technologies, local manufacturing. We need these key things to happen because of proper and ideal government intervention that improve that access and that care. So those are very critical. So being a product for the patient, it needs the patients to be involved as key players in the process, and their responsibility starts from knowing the scope of healthcare services that they need. And those scope of healthcare services that patients need range from health promotion, disease prevention, curative, rehabilitative, and palliative healthcare services. So now the next phase, what we'll be looking at is what responsibility does a patient have when it comes to the health promotion bit? What responsibility does a patient have when it gets to the health disease prevention, to curative, rehabilitative, and palliative services, and the overall scope of healthcare services, because we want to achieve universal healthcare coverage, which means each and every person, when and where they exist, they should be able to access all the forms of healthcare services that they need without suffering any financial hardship in that state. So how do we ensure we have a healthy society, and that healthy society, in case there's any form of disease or any form of unwellness, then they can access the services. And the patients who are most affected, who need to be catered for with the healthcare services, has to play a role. And that role starts here. So one, when you look at the health promotion bit, these are activities and services aligned to ensuring individuals lead healthy lives and adopt healthy lifestyles. This is where we talk about cessation of cigarette smoking, controlling your alcohol intake, or drinking responsibly as it should be. How do we ensure that as members of the society, we take charge of our lives? We all know that excessive alcohol use leads to liver failure, and those disruptions that are then affecting your entire functioning. It leads to shrinking of the brain, but we still consume them in excessive amounts, even when we know the implications of this. At the end of the day, when you are sick now because of the impacts of overuse of alcohol, you go to a hospital and you blame a doctor for delaying a surgical procedure that would have been done to excise a part of your liver which has been destroyed, for example, in liver cirrhosis. It's not the failure of the doctor, but you also as a person, you are not responsible enough to take the right action and doing the right thing when you needed to. So we need to adopt this. So with the growing burden of lifestyle diseases, we have all acknowledged cancers are on the rise, blood disorders, cardiovascular diseases, diabetes is even higher, and the most of these are attributed to our lifestyle conditions. How do we feed? Do we do physical activities? If we don't, what are we going to do? Like the exposure to chemicals in their environments, we need to ensure that we take care of ourselves, and that is one of the things that is very important. So as patients in these categories, in patient responsibility, we have to acknowledge that the health promotion, the messaging that is coming out is for our own good. It's for my good and it's for your good. So as a patient, if you acknowledge that, it means you'll be willing to adopt them and take ownership. And this reminds me of the reason that I felt we have an aspiration as a country, we have an aspiration as a globe, the entire human race, to achieve universal healthcare coverage. In the Kenyan context is the Big Four agenda. But every day that you hear people talking about the Big Four agenda, universal healthcare coverage, is the President Uhuru's Big Four agenda. So we have not taken ownership. And when we don't take ownership, we don't acknowledge it for our own good, there's no way we can mobilize resources and forces towards ensuring it's achieved. And that is a failure that we have. So in health promotion, the responsibility of the patient and every other person in the healthcare space is to acknowledge that each and every issue that needs to be addressed, it's not for another person. It's for my own good and it's for your good. And that is where we start. Then once we know that, we proactively need to adopt these health promotion services. We need to adopt the practices in our own lives, like for example, reducing alcohol intake, avoiding smoking, because you know cigarette smoking has got its implications from all the ranges of cancers, pulmonary fibrosis and all related. So you have to take action to avoid that. Encouraging healthy living, because you've gotten to a point that you're at least financially stable, the only activity you do is walk 2 flights of stairs into your car, you drive to work. When you get to work, a flight of stairs to the office, you're done. Then the evening, you come back home. Then on your way back, you stop at a pub, take 2 bottles of beer, drink that, and come back home. That is not healthy. And you know you need to do physical exercises. So we need to adopt these health promotion activities and health lifestyles, because at the end of the day, that's what's going to ensure we have a healthy society, and it even helps lessen the burden of care that we put on the government. If we have less of these diseases, the resources that are being allocated to healthcare services will be adequate because we have less of disease burden. But if we have more people getting sick because they're not doing what they need to do, then the resources will not be available. And when resources are not enough, most of our people will die from preventable deaths, and that is not the best way that we can do. So that is where we start, from the health promotion. What can we do as members of the society, as potential patients, or even probable patients where we are? And some of us are already patients because you find you have the risk factors for all these diseases, so you need an intervention even at that point. So we have to take an active role and be part of the health promotion by acknowledging it's for our good, proactively adopting it, and encouraging healthy living in our communities. Once I know I need to stay healthy, I'll do the best I can. And as I do that, I call on every other person to adopt the same healthy practices in their lives. That's point number 1. Are we on the same note with that?
Yes, yes.
Does that make sense? Perfect. The next one, we go to the disease prevention bit. And the disease prevention, we know there are different interventions that are used in preventing diseases among communities, among individuals, and it's based on the different disease categories. For example, when we're talking about waterborne diseases, we know there's need for hygiene measures in handling water, handling food, and all that. So we have to adopt them. When it comes to some of the vector-borne diseases, for example, I talked about malaria, leishmaniasis, we have to ensure we reduce the exposure to these vectors, and at the same time, we have to clear them if we can. And those are the interventions that need to be put in place. Other than that, we have environmental factors that are contributing to disease or ill health. For example, we had an issue of lead poisoning in coastal region because of the mine and all. We have to take an active role in ensuring these things are not happening and we prevent ourselves. We have sexually transmitted infections because of not using the preventive measure that we have. Why? How does that affect us? Because if we don't prevent ourselves from getting diseases, we'll have them, and it means the burden of disease and even in our healthcare systems will be strained. With a strained healthcare system, limited resources, as always, most of our people will die for things that they can prevent. So we have to adopt first the disease prevention measures, and these include hygiene measures, as I mentioned, use of protective materials. From even COVID-19 now, you find people putting on the masks, which have been recommended as clear protective measures against contracting COVID-19, but people are using it just to dupe the police officers from arresting them, from taking them in for flaunting the rules. It's not for the police officer. He might take you in, you go into the cells and all that, you'll be detained for a period of time, then be released. After that, what happens? What if you get COVID-19 and you get the severe form of it? It will be you dying, not the police officer that you're trying to convince that you're doing the right thing. So it starts from us knowing that our health is our responsibility, 1. And once we know it's our responsibility, it's for our own good, and we have a responsibility after protecting ourselves to protect every other person within our environment, within our vicinity, then we do the right thing. Public health measures such as fumigation. You need to clear bushes and shrubs around your homestead, for example, the vector-borne diseases. Use of mosquito-treated nets. Adopting them, we have to acknowledge that it's for our own good. Then we have to comprehend why we are doing it, understanding the why. Because that is one thing that I've realized. There's a group I am in a discussion with people, and they're like, we have to know the why we do what we do. Because when we know why we are doing it, it's easier to adopt it and apply. But when we don't know why we are doing a particular thing, we are losing in the overall equation. And when we lose in that overall equation, the expected benefits and positive outcomes that we hope for might not be realized because we are doing it for the sake of doing it. We need to know why we are doing it. We need to do it with dignity, with value inherent in terms of what we need to achieve with it. And when that is done, we'll be having a healthier society. Then we have to take responsibility for the welfare of our communities. That is the issue, like we're talking about COVID-19, sexually transmitted infections, unwanted pregnancies, people having unprotected sex, and we know they're having that sex, but they don't want to talk about it. People need to talk about the sex they have, adopt preventive measures from getting STIs, from getting unwanted pregnancies, and the range of all these issues that might complicate on our access to healthcare services and complicate our well-being as individuals. Once we do that and we move from that point of assigning blame, for example, now we're talking about policymakers not adopting the comprehensive sexuality education, but are we really talking about it in our own environment? Are we telling the people that they are at risk of being infected? Because once they know they are at a risk of being infected or getting unwanted pregnancies and all, then they are likely to adopt measures that will prevent them from getting to that point. But if we don't, it will only be a narrative of policymakers and advocates in one circle, but the patient is never involved. The patient is just a part of the equation that nobody wants to mention. And when we get to mention the patient, and the patient as an individual, as a member of the society, takes an active role and talks about what really affects them, what really needs to be done, and they adopt, not only talking about it. Because if I'm talking about something, I'm not practicing it, then it's better than even not talking about it at all. It doesn't help anyone. So that is one of the other things that we need to comprehend. And once we do that, we are at a better position. We have health promotion, we are leading a healthy life, and we are protecting ourselves from getting infected, getting diseases, whether they're the communicable, the non-communicable ones, vector-borne, hygiene-related. We are taking the first responsibility. Even in our feeding habits, people love eating mtura and all that. Mtura is good and all, but the hygiene measures, where do you buy it? Then after that, do you normally, it will get to be deworm, because you need to deworm after every other period of time, let's say 3 months. If you're not deworming, then you're at a risk of getting intestinal infections. Intestinal infections, when they manifest, you might get to be hospitalized. What is the impact of that disease on you as a person, especially when you have people who rely on you for support in a family setting? So these are some of the things that we have to acknowledge, to take responsibility for. And once we've taken responsibility for these, we are at a better position to avert the unwanted outcomes of these measures. And we have to take that responsibility. I know as a society, we are not so keen on taking responsibility. We normally talk about our rights without associating the responsibility that comes with that benefit that comes from the right. A right gives you a benefit and a privilege, but how you take responsibility to achieve that right is what's critical. And that is one thing, especially in the healthcare space, that we have not taken. And that is where we need to start this kind of discussion. Then from the disease prevention, we have the curative, rehabilitative, and palliative healthcare services. These are services that you need when, one, you are sick, you have a debilitating condition, or you are in the severe form of a condition that you need supportive care, palliative now. So when an individual becomes sick, the services offered to clear the infection are curative in nature. For the rehabilitative, you have a deformity, you need to be supported, or an illness, for example, the psychological issues, you need to be rehabilitated as well. Palliative care, you get a severe infection or a severe complication that's causing you so much discomfort. And for that discomfort, we need to improve your quality of life and reduce the discomfort. And that is why we need palliative services or hospice services. That is what the other term for them. So this care, one, when you are sick, when you have a complication, you'll go to seek care in a hospital. And when you go to seek care in a hospital, the kind of decision that the physician or the healthcare service provider you're going to interact with will make a decision based on the information you give them. So are you giving the requisite information, all the information relating to your disease state, or you're holding back because you feel like they might judge you, or you feel like it's not relevant? It is all that is relevant. And when you share that information, any piece of information that you will hold back on will have an influence on the quality of care that you receive. For example, this can be related to in terms of my background as a pharmacist. When you come to a pharmacy and you've been taking other medicines that you bought from another chemist somewhere, and you've come to the hospital, you've been prescribed a number of drugs, and I'm supposed to dispense. Without knowing which other medicines you're using, there's a risk for drug-drug interactions. If there are herbal remedies, drug product or use of the nutrition or supplements or any other interaction that might be there, the drug and the traditional medicine that you're using, interactions exist. The foods that you're eating, some foods will affect the drug metabolism pathway. That is going to affect how your response to that disease comes. If you don't share that information, it's a done. For example, now another thing that is of interest, because I had this case in my current practice where we have urinary tract infection, especially among ladies. And when you come to a hospital, you don't want to characterize it with any information that is being mentioned. For example, you come to a hospital, you ask about any discharge in terms, because you have a urinary infection, there's a risk of a discharge. And the question is, what color of that discharge? Is there any smell that's associated with it? We don't even take care of ourselves to acknowledge or recognize any anomaly, to recognize the kind of discharge that we have. And if that is not done, it would be for the doctor or the clinician or the physician to make a guess. And in healthcare, any guess that doesn't come out to be right is a compromise on your quality of care. But is it the failure of the doctor to do the right thing? No, it is your failure as a patient who is seeking care not to give the required information to improve the quality of services you get so that you can get better. So that is one thing that also needs to be catered for. So you have a responsibility to give all the information pertaining to your disease state, and there's a clacking formula for the information seeking from patients that doctors abide by and apply in their care. So you need to fill them with all the information they need. When you don't understand anything in the point of care, you need to seek clarification. For example, when you go to a hospital, this is a normal complaint that I've also heard from a number of people. You explain your symptoms to the doctor and all of the clinician, and when you're doing it, it's a matter of taking notes. Then they give you a prescription to go take your medicines. It is your right to know what condition they suspect you are sick of, you're ailing from. Then once you know you have a suspicion of that condition, you need to know the differential diagnosis, the final diagnosis that they're making on, for example, I'm told, David, you have malaria. What are the probable risk factors to malaria? Probably having traveled to a malaria endemic zone, but I haven't traveled out of Nairobi for the last 8 months. So it means chances might be minimal. And that even enables the doctor to get to review their clinical knowledge and ensure that you get the best quality of care. Because if you don't ask, sometimes there are different diseases that come with the same related symptoms. And when somebody treats you for one which is not the actual condition that you're suffering from, or even you didn't disclose your travel schedule and all, you might be treated for typhoid when it's malaria, and you might be treated for typhoid when it's brucellosis. So how do we have to know the difference between the two? By you giving the right information, seeking clarification to know better about what's happening. Then once you've sought the clarification, you come to a care plan with the clinician or the physician, you need to follow the instructions as agreed upon with the caregiver. If you've been prescribed a number of drugs, you come to the pharmacy, I ensure that I dispense them and counsel you the right way on how to use them. It's your responsibility to comply. If you're told to take the drugs after every 12 hours, it means 6 in the morning, 6 in the evening, or 7, whichever time, but there has to be a 12-hour gap in between. You have to abide by that. Because failure to do that, it means you are not complying with your own care that you've agreed on. And if it's an infectious disease, you have a risk of transmitting it to others. If it's not infectious, you as a person, your functionality is compromised. You have people depending on you, you're not going to provide for them. You have a job where you have to work, you're not going to be reporting to that work because you're not at the best state. What are the implications? Economic output will reduce and all that. And you even risk dying from that disease, because that is something that you have also to acknowledge. The risk of not taking your medicine, seeking care, and using that care is you either fail, you get complications arise, you can even die from those complications. So you have to follow instructions, compliance, and adherence to your medication or care plan. Very important. That is your responsibility as a patient. And a patient, as I mentioned, is not only someone who is sick, but anybody who needs healthcare services, as we stated. So in the curative is someone who is sick. Then 2, you have to be respectful and thoughtful in the entire care arrangement. You have to be respectful to the people you're interacting with. For example, when you get to a hospital, there are so many other patients who are also waiting for care. Upon triage, there are people who have severe complications they need to be attended to first. We need to be respectful of such people. And we also need to acknowledge that somebody might look okay, but their complications are there. So we have to accommodate every other person. And as I mentioned at start, your rights as a patient stop at the point when it infringes on another person's rights. You are going to interact with a clinician or a healthcare worker in a hospital, and you're already too rude to them. We are human beings before any other thing. We are human beings before we become doctors, before we become any clinicians. So when you come and you be aggressive and combative in your the interaction, then as a human being, what happens is I will feel offended a little bit, or maybe to an extent, depending on how I respond to issues. And then with me being offended, the quality of care that you receive might be compromised. I didn't say will be, it might be compromised depending on how the encounter becomes. So what impact does that have? It has an impact because you as a person who is causing all this might not get the best quality of care, meaning your treatment will not be the best. Two, the people who are coming after you, at times we get affected by an individual and it's cascaded to every other person. So imagine the whole group of people who are seeing this doctor after you will suffer the consequences of your combativeness, your disrespect. That is not the best way to go. So we have to acknowledge that we are all human beings with different limitations and different perceptions on how things work, and we have to accommodate each other within that arrangement. Be respectful, be thoughtful. If you're admitted in a hospital, you have to respect the rights of every other patient. You can't be making noise to them and every other time when you feel like. You can't be smoking in a hospital setup when you feel like you need that smoke because you're already addicted to the nicotine, but other people are not using nicotine. So you have to give them that space. So such kind of measures are in place, and we have to ensure we abide by them and be respectful and thoughtful. Be considerate of the people within the whole care plan, and even your caregivers, the family members who visit, they have to accommodate every other person within that arrangement. That's another very important aspect of it. Then, continuation, you have to accept the results or the outcomes of care based on the compliance to medicines, that's one. Other than that, you have to accept the outcomes of care depending on your clinical condition. There's one thing that as a society we have a challenge with is accepting that at some point, it's not every disease that will be cured. And at times, the normal human process is you're born, you live through things, you get cured when you are sick. At one point, the cure might not work. So when that does happen, there's a risk of dying. We have to accept those outcomes and embrace it as part of the human existence. And that is one thing that has affected us because every other time when someone succumbs to a disease or a particular complication, the first thing that happens is blaming the healthcare providers. And when somebody blames you, for example, if you've tried the best you could, it affects your morale, it affects your ability to live on care, and that affects the entire chain. So we have to accept the results or outcomes of care based on their compliance, and this is where the communication is critical. The medical doctor needs to tell you that, well, the way the conditions are, the medical condition as it's progressing, there's a risk of dying, and that is the good part. For example, when you have cancer patients, it's communicated that you have a risk of dying from this complication, and because of that risk, this is the percentage. So in case it happens, you already get prepared psychologically for it. And that is one thing that we need to communicate and be willing to accept those results or those outcomes and deal with it moving forward. It's a normal, natural process of living. Then you have to abide by the health facility rules and regulations. You have to be tried through the triage station, the emergency ER section. You have to be moved through the whole process. That is what needs to be done. Flaunting those rules will ultimately lead to you rubbing shoulders with other people and doesn't improve any care plan. And that affects every other person. If you're sick, you've sought the care you needed and it's been rendered to you, it's your responsibility to meet your financial commitment for the care as agreed upon or determined in the care plan. And in meeting your financial commitment, it's ensuring that that hospital will continue running. That's one. If you, for example, if it's the private sector, in the public hospitals as well, there are some situations where you have to pay except for the primary level facilities where it's covered by the government. So you have to meet your financial commitments. Otherwise, you'll be the very person who is not meeting your financial commitments, making other people miss on their healthcare services that they need. But when, as a society, we keep blaming the government. So we have to ensure that as an individual, I've met my responsibility, I'm accountable enough, I'm doing what I need to do, then that leads to the next phase of care. Then we have to strive to get better and comply with the care protocol. It's your responsibility to get better by using the medicines the way they should be done. And in case there's any complication, you need to keep following up with your healthcare team. Because if you don't follow up, you might develop complications which you are not communicating, and it might cost your life, which would be prevented if you communicated. So striving to get better means you seek as much information from the people who can give you the care. You inform them, update them about any side effects, any adverse outcomes, and any improvements that you're also getting, so that they know whether the drug is working well for you or not working well. And it is you who has a way to make that happen. And it's very important. For the overall scope of patient responsibility in care, you are a key stakeholder, and every other person in the society who needs healthcare services is a key stakeholder in the healthcare space and should act as a major stakeholder. Your responsibility involves improving access to healthcare services for those who need them. You have to call people, to call the government, call on the healthcare practitioner to ensure they give quality care. But in the process, you also have to do your part, as we've discussed earlier. You need to encourage uptake of healthcare services. You can't hold the government and healthcare providers accountable to offer services, yet nobody is going to seek those care. You have to seek care when you need it. And especially this has been a narrative about men not being willing to take up services, which affects the outcome of our lives. And that's why we have, even, for example, the life expectancy, we have a 2-year deficit between men and women, because most of men, when you're sick, you stay to the last moment for you to seek care. We need to encourage each other that whenever you're feeling unwell, you need to seek care. And that's why these services are being provided in the different facilities. We have a responsibility to protect communities from disease, infirmity, and sickness-associated morbidity and mortality. Health promotion, very key. Disease prevention, optimum. Once we abide by those, we are protecting ourselves and our communities. It means we are moving towards our aspiration and our goal of a healthy society. Then improve on quality of care being rendered to patients. When you ask questions, you make the doctor want to read more and give you the best quality of care. And when that happens, you will get a better service, and that knowledge helps him or her give better services to the next patient that comes in with almost related complications. So that improves the overall care plan. And you have a responsibility to improve that quality of care, because we learn from probing and getting more answers and researching more. When you ask questions that are critical, then the doctor looks for more information, they improve the care they give, and they ensure that you as an individual, even when you hold the government accountable, the government invests in resources. When these resources are available, the healthcare workers are able to deliver better services and quality care, which benefits you, the people around you, and the entire community. So you have to be committed to that. The how. Adopt health promotion activities. You comply with disease prevention measures and encourage others to comply. Take an active role in your care. Give truthful information, complete information, comprehensive as it can get. Engage the caregiver, talk to them and get to understand the complications. And in case they need any further clarification, make it coming. Comply with the care protocol. Compliance and adherence to your medication is very important. Follow up with the caregiver in case of concerns and meet your financial obligations. There's no care that happens without any resources invested. Human resources, the labor has to be paid. For example, even the cleaner in a hospital setup. If you don't meet your financial obligation, you don't pay for that care, that cleaner won't get paid because there's no money. When that cleaner is not paid, the risk not coming to work, that's one. Two, their family is not provided for. When their family is not provided for, it affects the overall quality of care. Be respectful, thoughtful, and considerate at all times. That is the ultimate thing. So taking responsibility for oneself is by definition an act of kindness. That was by Sharon Salzberg. And what is an effective healthcare partnership? An effective healthcare partnership includes health providers working in concert with patients and family caregivers to achieve positive experiences and mutually agreed upon outcomes. But at the same time, it ensures that the patient and the family caregivers share insights and context about their needs, their goals, their preferences, and experiences in collaboration with health providers, who in turn will contribute their clinical knowledge and expertise. Each member of the team is encouraged to bring a unique perspective into a continuously learning healthcare partnership. Encourage learning, improve quality of outcomes, and share your preferences, your interests. And at the end of the day, we all achieve the quality health outcomes that we wish for. And that is the main goal. And when we talk about the preferences, for example, as in the pharmacy context, there are people who can prefer injections over getting oral drugs, for example, the tablets or the capsules. So if that is your preference, you need to communicate it. In the sexual reproductive health realm, we have oral contraceptives, we have injectable, we have implants. You need to communicate your preferences and help the clinician or the caregiver discuss all the options with you and realize that this is what works best for you and ensure that it's what you get. If you don't do that, the quality of care is compromised, your health as a person is compromised, and the entire society loses by not getting the best outcome they would have gotten if they all played their part. So let's do our part, and let's make a difference by taking responsibility, not only talking about our rights and what we are privileged to have. Let's let go of the entitlement aspect and take an active role to drive the agenda together with all the other people who are part of the narrative. Thank you so much. That marks the end of my presentation. So Hezron, back to you.
Thank you so much, David, for the great presentation. I'm sure we've all learned something on patient responsibility in healthcare. So now we're moving into questions. So if you have any questions, you can type them or just raise your hand and ask them. So meanwhile, maybe I could ask what I had in mind. How can patients be enlightened on their responsibilities in healthcare? Because I believe many patients aren't aware of that they have a role to play.
So what I feel like as we need to do in the healthcare sector, if you are a healthcare worker, it's your responsibility to ensure you engage your patients and encourage them to ask the questions that they need to ask. That is one, creating an enabling environment for them to ask and play that role. After that, we have advocacy groups that are engaged in these discussions around health and all that. They call themselves, or we call ourselves, as health advocates. Do we tell the patients what they really need to do, or do we tell them what they are entitled to? Because most of the times, even in the media debates that we have, it's a matter of looking at the rights of the patients. We need to be objective as a society, as health advocates, and tell people, this is what you need to do, and this is your responsibility. Please do it. Let's not lie to one another. The same way, Hezron, you're my friend. I see probably you are making a mistake somewhere, but because I don't want to make you feel offended, I walk around the problem. I'll walk around telling you the truth of what you need to do and act like everything is okay. That is lying to one another. And as a society, we've encouraged lying to one another, fooling each other by not telling us what we need to do, what our responsibility is. Nobody loves accountability, but it is what is going to help us move out of this. So for me, how do we enlighten patients? At the healthcare setting, medical practitioners and workers, where you are, engage your patients. Health advocates, when you reach out to communities, for example, we have community, like the outreach programs, the medical camps and all. Let people tell the patient that when you're talking to them about healthy lifestyle, nutrition, or counseling and all, tell them those are important for the disease prevention, the health promotion bit. But when they're sick, they need to probe and get more in clarification. It is their right and it is their responsibility at the same time. Let them seek it rather than coming to blame healthcare providers for not giving them the care. And after that, they need to know what components come in. Let them know. When we have these contributions where we have social media is a platform that everybody relies on, when you're online on your Twitter handle, your Instagram account and all that, make a tweet about a discussion. For example, we have different health debates that are going on. We have to bring our voice as individuals to show we are not only consumers of these healthcare services. We also have a role to ensure that these healthcare services are responsive to our needs. We are staying healthy as much as we can. We are playing our part, and that is how it goes. So every platform where you are a patient, whether you are sick or not, because at one point or in any point, you need a healthcare service. You need to promote your health. That stays with you from birth to death. And then another program, like, for example, the work that you're doing with Planet Wizard, Hezron. With Planet Wizard, you share information about healthy living, health promotion and all. People need to take up this information, and we need to ensure that we promote it, let it reach out as many people as possible, so that we see our role in healthcare and our role in ensuring we achieve our aspirations for a healthy society and the universal healthcare coverage. I hope that answers the scope of the question that you had.
Yes, thank you. Thank you so much for that. Then I think also, speaking of that, I think also the new practices such as the MTM, which is the medication therapeutic management, like things like taking the patient history and knowing more about the patient somehow helps them to open up about their life, and I think that can be helpful when giving out the medications and all that.
Yeah.
Yeah, so there's another question here I'm being asked by Fatuma Haji. So in a situation where the patient thinks that they know more than you, the healthcare provider, how do you help them seek medical advice? Or how do you bring forth your knowledge of what they need to know?
Well, when the patient feels like they know more than you do, it happens, especially with Dr. Google taking charge of our healthcare services. Because everybody, when you have a condition, the first place to go is the internet. And with the internet, any kind of pain is normally cancer. Abdominal pain can be liver disease or kidney disease. So when such a patient comes to your practice or someone, you're trying to educate them, but they don't feel like they trust you as much, start from the basics. What makes them feel they know what they're suffering from? Give them the platform, because what I've realized with human nature, as human beings, we love getting the airtime to talk about what we feel we know. So let that person talk about what they know. Once they've talked about what they know, ask questions aligned to what claims they're putting forth for you. For example, if I'm suspecting I have malaria and I've not traveled, what would be the risk of exposure? When you start asking such critical questions that are making, those are professionally and clinically aligned questions that will make someone question their own perception or their own initial diagnosis that they had for themselves. And if you lead them that trail, definitely at one point they realize this was not the best of the decision that I would have made, the best diagnosis that I needed. So now from that point, when they've realized they've questioned their own judgment, they put it back on you as the care provider. So at that point, that is where you walk with them the journey of making a diagnosis and ensuring that now this is the diagnosis that you're making, this is the care plan they need to take. But if you be combative and tell them what you feel is right for them without considering their perspective, they'll be against it. And when they are against it, definitely compliance will be an issue. So you're doing it out of your desire to make things better for them, but they don't see that aspect. And that is a losing battle for everyone. So that is something that we all have to acknowledge and we have to take part in. I hope that answers you, Fatuma. Hezron?
Yes, yeah. So I'm not seeing any other questions, not unless also on Facebook we don't have any questions with us today. So maybe I don't know if there's anyone else.
I'm seeing a question on my end. How do we deal with the caregivers who just engage patients? A number of times patients inquire, but they are told to just do as they've been told, and it gets hard to communicate. How do we go about it? Well, in such a situation, one, the clinician is not willing to do the information, give the information that she's supposed to give. And this can be related to what Fatima was alluding to. The patient feels like they know so much, and the doctor also feels like you feel entitled, so they don't want to give you that much information. So that is another compromise. But then I believe in the clinical practice setting, we have healthcare providers and they have the associations and the professional organizations. This has to be communicated through the professional associations. Patient advocacy, the patient welfare counts as a critical part of practice as a professional. So professional associations, whether in school, universities, whether in practice or when you graduated and all, they need to let you know you have a responsibility to the patient, and the quality of care, however much you feel like you have the right diagnosis, the patient needs to be part of that process. They need to see that this is for them. If you don't feel it's good for them, it's what they really need, they won't take it up. So your own best interest, you are acting in their best interest, but being they're not complying with it, you're losing the battle. So why not just tone down your ego a little bit, bring them in as people who need your services, and once you realize they need your services, engage them in that angle. But this can only be done within the professional circles where you let your professionals also know and your colleagues that they have a responsibility to engage patients, they have a responsibility to accommodate the questions that the patients might have. Because what I realized in practice for the period that I've been at work, patients at times, in aspect of health, it's not only the disease that they are coming to tell you. They have the disease, but there are different social and psychological issues that are happening in their lives that make them need somebody to listen. And if you can listen to them, you give them the best environment, and probably they'll feel better even without taking the medicine. Or the medicine would be like a placebo. For example, somebody comes, the best you give them is a painkiller because you can't make a diagnosis on what they're suffering from. But if you engage them for like 10 minutes, just talking to them, listening to them, they feel relieved. That person gets better without even the medicine doing its work as much as you thought it was curing them. But it's because of the engaging that patient, making the patient feel like you're someone, a caregiver. You are nurturing them, you are giving care that they really seek. And that helps them get better. And that is the main core. For me as a pharmacist, as a medical practitioner, I think that's what I believe is my role. I need to help someone. I need to give the care that they need and make them feel like you are there for them. And when you're there for them, you listen to them, help them through the process. And what really matters is their well-being at that point. And if you can make them get better, the best you can. And that is an achievement. So it doesn't matter how long it takes, how bad it goes, but that person needs your care. Listen to them. And it's us as professionals to inculcate that culture within our circles to drive a common agenda for the patient and for the betterment of the profession and practice of medicine. I hope that answers you. So back to you, Hezron. I think
There's another question here also. How do you teach people about patient responsibilities, especially in these times when the medical society or probably the healthcare workers probably they're not being trusted or they're not doing their work well. So especially for those who typically don't believe in hospitals or even doctors, how do you tell them about their right as a patient?
Please come up.
Have you understood that?
Come up again.
How do you teach people about patient responsibilities, especially in these times when our medical society isn't the best? I guess it's with regards to probably COVID-19 or something like that. So, and also the person has added, especially those who typically don't believe in hospitals or even doctors. How do you tell them about their right as a patient?
Well, the trust in the healthcare practice and the healthcare service providers is dwindling, and that's something that we have to acknowledge. But we need to ask ourselves the very question is, why is it going down? Have we not made the public see that we're playing a role? Because if that's the case, that is what we need to sort first. That is the starting point. Two, once we've acknowledged that that is dwindling, at the end of the day, these people, whether they believe in healthcare services, in the medical sector, or they don't. Hello? Either way, these people still seek healthcare services. So if they seek healthcare services, where do they seek it? Because there's someone they'll go to, even if it's the traditional healers and all. Those are the very people who we need to use as influencers. I remember there's this point when issues on female genital mutilation was a very big issue in the Maasai community. And it started from the AMREF end where they were engaging the local leaders. The people who are practicing this were the elderly women in the community and all. If you engage them, they feel like they can make a difference in it. And when they're doing it, they own it up. So you have to use the people who are trusted. If, for example, when I need something from you, Hezron, as my friend, I know someone who is close to you who will make you comply to my request. And if you do that, I'll have won the battle. So who is that person that I can use? That is the main bit where we have to start. And that is where we have to even look at our leaders, the people we elect into leadership position. They have been trusted by the society. So can they advocate for the right agenda? If we have an influential figure who is already against the healthcare system, then it can't work because the society, the people who believe in this guy, won't subscribe to your ideals when they're already not inclined to what you're telling them. So that is where we have to start. Look at the people who they look up to, people who can talk to them and make them see the point in what you're trying to let them know. They have a responsibility. You feel that we don't trust the doctors. Why don't we trust them? Because of this and this. Let us tell them this is why we don't trust you, and you have to do better so that we address this issue. Because it doesn't mean that we don't need healthcare services. We need them. So how do we ensure that your need for healthcare services is matched by ensuring their quality, and everybody plays their role to ensure they're the best? I hope that answers you.
Yes, I think it answers the person. Yeah, so I don't see any other question here. There's just one comment from Andred saying Enlightened, very good information for family caregivers.
Thank you so
Yeah,
much.
so maybe you could give closing remarks, David.
Thank you, Hezron. It's been a pleasure being part of this discussion. This is our 5th session. And so far, we've made, I believe people have learned from this. People are getting the points, and even our YouTube videos that we're sharing after the recordings after this session, you are free to share it with your networks. Let's make a difference. And for now, for the people who are here, you are a patient because you need healthcare services, whether the promotive, disease prevention, curative, rehabilitative, or palliative, you need healthcare services. Will you play your role? If you don't, then you'll fail the entire society, yourself, and the generation that comes after you. So play the part. Let's make a difference together. Asanteni. Back to you, Hezron.
Yeah, so thank you so much, David, for the insightful session. And I believe we've all picked something which matters to us. So maybe before we end the session, maybe you guys can introduce themselves, what they do, so that we just know each other. Thank you.
That's okay.
Maybe we can start with Dr. Muli.
Dr. Muli. The next probable person has.
Yeah, we have Kelvin Muridi. Kelvin, maybe you can introduce yourself.
Okay.
What you
Hello.
do.
Hello.
Hello, yes, Kelvin, we can hear you.
Oh, my name is Muridi Kevin. What else should I say? What I do?
Yeah.
I'm working on. I'm passionate about mental health, so usually have discussion sessions on Saturdays as a part of the culture program where we discuss mental health issues and trying to raise awareness about mental health. Thank you.
Thank you so much, Kelvin. We have Nambi. Nambi, please introduce yourself and what you do.
My name is Chisia Eve Mutanda. I'm a student of, I take pharmacy in Kenyatta University, level 3. I'm so happy to join these discussions and they're so informative. So I'd like to say thank you, Dr. Ali.
Thank you so much, Nabi. And the next person is Rogers Harrison. Please introduce yourself.
Hello, my name is Roger Harrison. I'm a senior lecturer in public health at the University of Manchester in the United Kingdom. And I'm very interested in supporting health systems in sub-Saharan Africa with a special interest in educating the public on the topic of antibiotic drug resistance. Thank you.
It's a pleasure to have you here with us,
Dr.
Dr. Roger Harrison.
Yeah, so maybe we could move to the next person. That's Edmund. I can see his audio is not connected. And finally, maybe Dr. David, you can introduce yourself.
Well, Odhiambo David, I'm a pharmacist by profession, and I run agriculture, health, and social innovation. So my passion is around driving health systems, development and improvement. And for our focus has been on social responsibility and social accountability. How do we ensure that everybody plays their role to ensure we have responsive and functioning healthcare systems? If that's achieved, that would be a win for me. And it has to take the whole society. That's where the social responsibility bit comes into place. So that's what I'm passionate about. Thank you so much, Ezra.
Thank you so much, David. So finally, I'll just introduce myself. My name is Hezron Munyakin, and I'm a team player at Agriculture, and also the founder of Planet Wizard, which is a health magazine. And what we do is share healthcare information with the goal of transforming health system from sick to healthcare. So finally, I'd like to thank all participants for joining us today. And also for those who have joined us on Facebook Live, thank you so much. And we appreciate that you have been here with us today. So we're going to share the word recording on our YouTube channel on Reculture. And please share with your colleagues because I believe they'll benefit from it. So thank you so much and hoping to see you next week. Thank you.
Thank you so much. It's been a pleasure.